Hi everyone. So this is the second lecture of your chapter Dentin. In this lecture, we'll discuss about the theories of pain transmission. Okay, so the nerve supply of dentin. Then we'll talk about dentinogenesis and then the types of dentin. So the types of dentin, you'll understand that better once you know about dentinogenesis. Okay, so starting with this topic, theories of nerve transmission, pain transmission. So this is talking about how a pain actually gets transmitted through the dentine. So if I have a stimuli acting on my dentine, heat, cold, or any mechanical force even, how would you feel it? We don't know what is the exact structure of nerves inside our dentine. Okay, so first is that the nerve fibers accompany only 30 to 70% of the odontoblastic processes. Okay, and these nerves are known as intratubular nerves. So I told you about the structure of the odontoblastic processes or the tubules. Okay, so this is the tubule and you have a process inside that. This is your odontoblastic body which is inside the pulp, right? So there is a nerve that will be going along with the odontoblastic process inside the tubule. But so there are three theories based on which are telling you how the pain is actually sensed or transmitted through this process. Okay, so the first theory is the direct neural stimulation. So what this theory suggests is that you have this pain, you have this stimuli that will act directly on the dentine. So it is saying that there is a nerve fiber that is uh, a nerve fiber that is running along the odontoblastic process through its entire length. So the stimuli will act directly on the nerve fiber and you will feel a pain. But this theory is mostly rejected. Why? Because the nerve fibers we have inside the dentinal tubules, they are short. Okay, so they mostly run up to here. Okay, they don't go beyond a certain level in the dentine. Okay, also because if there were nerves on the surface of the dentine, when we apply local anesthesia over here, we should feel some numbness. Okay, but that doesn't happen. We don't get any numbness when we apply anesthesia on the dentine. So this is the reason why this theory is not widely accepted. Okay, now the second theory, that is the hydrodynamic theory. This is the most accepted theory. What this theory suggests is that you have this odontoblastic process. Okay, this is your tubule and you have this process inside here and the remaining space in here. Okay, so the remaining space, this is filled with dentinal fluid. Some sort of fluid is here. Okay, and when there is a mechanical stimuli, this fluid so there is a stimuli, so this fluid will move. Okay, so maybe there is heat or cold, this fluid will move and that will transmit the impulse to any nerve fibers that may be over here. Okay, so there are some nerve fibers in here and the movement of the fluid will transmit your impulse or the stimuli. So this is the most accepted theory. Then the third theory is the transduction theory. Okay, so what this theory suggests is that the nerve impulse, the processes it's themselves, they get excited by the stimulus and the impulse is transmitted to the nerve ending in the inner dentine. Okay, so what this is saying, in the first theory we were saying that there are nerve fibers up here. This is saying that there are no nerve fibers up here, but we do have odontoblastic process. So the process itself, okay, so this odontoblast itself, it will get excited by the stimuli and there are some nerve endings over here, so it will transmit the information. But this theory is not actually, this is also not well accepted. Why? Because we don't have any neurotransmitters over here. So for the odontoblastic process to transmit this impulse, we need some sort of neurotransmitter, some vesicles, but we don't find it over here. So this theory is also not widely accepted. Okay, now moving on to the next topic, that is your dentinogenesis. So what happens in dentinogenesis? It is the process of dentine formation by odontoblasts. So you know odontoblasts are the cells that form dentine, right? Uh, I'll just walk you through how it starts. So if you remember, we have all the bud stage and everything, bell stage, advanced bell stage. So this is your enamel organ. Okay, I have the diagram over here, so I'll just zoom in over here. Right. So this is your enamel organ. When your tooth is being formed, this is your enamel organ. Now what is happening is, these are your inner enamel epithelium cells. Okay, these are your inner ameloblasts, pre-ameloblasts. Okay, when they start laying the enamel, over here you can see there is some enamel. So these cells started laying the enamel. Now what happened is, um, so after the enamel is laid, this enamel will send some signals into the dental papilla. Okay, so these are the pre-odontoblasts. These signals will be taken up by these pre-odontoblast cells, and they will transform from an ovoid shape into a columnar shape. Okay, and this elongation of the cell, it will, because of this elongation of the cell, it will come in contact with your basal lamina. Okay, so this is the basal lamina, it will come in contact with the cell. Now this will start growing an odontoblastic process. So this cell, your pre-odontoblast, changed into a columnar cell, and now it has converted into an odontoblast cell. Okay, what is an odontoblast? That will lay down the dentine. So now it grew a process. Now it will start laying dentine. So you can say this is the first layer of dentine that it is laid. It has laid, and it is called a predentine. Why pre-dentin? So the laying of dentin has two steps. Okay, first is laying of the organic matrix, and second is the mineralization. So it's like, how you would make, if you're cooking something, so how you would put in the gravy first. Okay, let's say you're cooking paneer, so you would make the gravy first, right? And then you would put the paneer in. Alright, so it is similar to that. So first you would make the entire matrix like a gravy, right? And then you would start mineralizing it, so solidifying it. So instead of just putting a few cubes of paneer, just imagine that you put in so much paneer that you have a thick solid kind of preparation, right? So that would be mineralization. So over here, first what happened was the ovoid cell got converted into columnar cell. Then it grew a process, and the first layer of dentine, the predentine, was laid. And then the odontoblast will start growing backwards over here, because this is all in here, right? So the odontoblast will start going backwards, and this all space will start filling with the dentine, right? So the first layer of the predentine, now it is mineralized. So the second step has taken place, and now it is mineralized. And you can see as it's going backwards, a second layer of predentine is laid over here. So this is a gross view of how dentinogenesis takes place. Okay, so I'll go through it once again in the notes, right? So what happens is, the dentinogenesis, it begins at the cusp or the incisal edges and progresses apically. So it progresses like this. Okay, so the first stage, there are phases of dentinogenesis. The first phase is the odontoblast differentiation. Okay, so it is induced by enamel organ. So you can see the enamel organ, it forms the enamel, and then that induces the dentinogenesis. Okay, especially the inner enamel epithelium. Inner enamel epithelium releases some factors like TGF, IGF, and BMP, which are taken up by the pre-odontoblast. So these cells, I told you, these are the pre-odontoblast, and the enamel organ, it signals the pre-odontoblast to start laying the dentine or start differentiating and then laying the dentine. The pre-odontoblast change from the ovoid to columnar shape. So I told you that was step 1. Then their nuclei becomes basally oriented. Okay, and then they differentiate into odontoblast. Processes arise from the apical end of the cell in contact with the basal lamina. So I told you all of this. The first step that would happen is that the columnar, the pre-odontoblast, they change their shape from ovoid to columnar. Then they start growing processes, and then they have their nuclei shifted basally. Okay, basal nuclei, and then they start growing processes, and then they start laying dentine. Okay, so this is the sequence of odontoblast differentiation. If you see over here, you can also see, this is a diagram. So you have this enamel organ. This is your inner enamel epithelium, this late dentin. So this was the dentin. This is how the dentin is going, and you can see odontoblasts over here. They are growing in this direction, and they are laying dentin like this. Okay, so the dentin will be growing apically like this. So the next layer will be here, and then the next layer will be here. Okay, and the odontoblast will be over here. So this is the growth direction of the dentin. Now the second step is, I told you, matrix formation. So as it is going, the first layer, the dentin will lay over here. If I talk about the next layer, first it will lay an organic matrix over here. Okay, so that won't have any minerals. It will have really small amount of minerals. Okay, and this will be like the gravy. Then after some time it will mineralize, so it will the hydroxyapatite crystals will come in. Okay, and it will get mineralized. So that would be the second stage. By this time your odontoblastic processes would be here. Okay, odontoblasts will be over here, and then they would have laid a second unmineralized layer. The unmineralized layer is called the predentin. Okay, so talking about the second step. So first we talked about the odontoblastic differentiation. Now we'll talk about the matrix formation, the gravy formation, right? So odontoblasts secrete predentin composed mainly of type 1 collagen. So your organic matrix, it mainly has type 1 collagen. Predentin is the unmineralized organic matrix. So whatever the first organic substances laid down, that is called the predentin. Initially 4 micrometer of dentin is formed per day in the crown until the crown erupts. Okay, and the teeth move into occlusion. After the teeth move into occlusion, the dentin produce close to about 1 micrometers per day. Okay, so this is the daily formation of dentin. Initially, when the teeth are unerupted or they are not completely into occlusion, the daily amount of dentin form is 4 micrometers per day. After this, after the teeth are into occlusion, it is 1 micrometers per day. So dentin is formed throughout life. It just slows down the formation. Okay. Again, you can see over here, this is your enamel. This is your first layer of dentin, that is the predentin or the organic matrix. And as the odontoblasts move backwards, this layer is mineralized and a second layer of organic matrix is formed, predentin. Okay. Then mineralization, that is the third step. So now we are talking about moving from here to here, how this predentin, the first layer, got mineralized. Okay. So this begins 24 hours after the matrix deposition, right? The calcium and the phosphate from hydroxyapatite crystals mineral. This is because the hydroxyapatite crystals, they are laid into the collagen on top of the collagen fibers. Okay, mineralize occurs in the globular and linear pattern. So there are two patterns of mineralization. Okay, what is the globular pattern and what is the linear pattern? This is not very complicated. So you see over here, if you look at this diagram, this is your predentin. Okay, so how will the mineralization take place? First is you randomly place some crystals like this, right? And they grow, and after growing they fuse together, and your entire dentin is now mineralized. Okay, now the second pattern is they are laying down the crystals in a linear pattern. Okay, so they are close together and they are in a straight line, so it appears more uniform. They also grow and they fuse together, but the linear pattern over here, this just appears more uniform, and there are less chances of having um, uh, of errors in the linear pattern. Okay, so talking about the first pattern, in the coronal dentin, this happens in the coronal dentin near the mantle dentin. We'll talk about that. Mantle dentin is just the first layer of dentin that is laid. Okay, so this will be the near the cusp. So if this is your tooth, the first layer of dentin that will be present, that is the mantle dentin. Then globules of hydroxyapatite crystals are deposited and they fuse to form a homogeneous mask, what I told you over here. Okay, then the linear pattern, this happens in the radicular dentin, so in the root dentin. Okay, near the root tips. This is slower because the crystals are smaller. Okay, not the crystals are smaller, the globules are smaller. Okay, crystals deposit along the collagen fibers. They fuse at an early they fuse early at smaller size, okay, and mineralization front is straight. So if you look in the globular pattern, this appears like haphazard, right? But over here the mineralization appears like it is taking place in straight lines, okay. So this is the mineralization front. Now talking about the predentin. So now we have talked about the nerve supply and the dentinogenesis. Now we'll move on to some of the structures that we didn't discuss in the first lecture. Okay. So the structures will have predentin and some other types of dentin. So over here you can see we have mantle dentin, circumpulpal dentin, secondary dentin, and predentin. Okay, so these are all the types of dentines. We'll discuss all of this, and it's easier to understand it after you have studied dentinogenesis. And then we have another type of interglobular dentine. Okay, so first I'll talk about predentine and then we'll move on to the more complicated ones. So predentine, I think by now you already know it is located adjacent to the pulp tissue. So see, this will be located anywhere that is the last part of the odontoblastic process. Okay, so if the odontoblastic process is ending over here, the predentin will always be the last layer, the latest layer of dentin that is formed. So that is always formed over here. Okay, so because the odontoblastic process is located inside the pulp, so this is the pulp. So this predentin, after the tooth has formed and everything, this is always located adjacent to the pulp tissue. Okay, and it is 2 to 6 micrometers wide, and it is not mineralized, so that's why it is called predentine. It appears pale staining to the difference because of the difference in the composition of the matrix, okay, because it is not mineralized. As the collagen fibers of the predentine mineralize, it becomes dentine. So this should be predentine mineralized, it becomes dentine, and a new layer of predentin forms circumpulpally. So I'll this is nothing new. Okay, this is just saying that if I had the predentin over here maybe a few days ago, right, it will mineralize and it will become circumpulpal dentin. So I'll talk about that in the next slide. And then a new layer, so the odontoblastic process would move down and a new layer of predentin will form over here. Okay, so that's it. Now, and coming to the types of dentin. So we have three types: primary, secondary, and tertiary. So tertiary will not be discussing in this video because it is not normal. Okay, it's not formed in everyone. It is due to some stimuli or some injury. Okay, so this is reparative dentin. So it is only formed upon some injury when you need any repair. So we won't be talking about that in this lecture. We'll talk about the primary and the secondary dentin. Okay, so the primary dentin, first layer is over here. Okay, so the primary, you can see the primary dentin has two parts. It has mantle dentin and it has circumpulpal dentin. Right. So mantle dentin is the first layer of dentin that was ever laid. So the first layer just below the enamel, this is your mantle dentin. Okay. And the rest of the bulk of the dentin, that is the circumpulpal dentin. So it forms the bulk of the tooth. So these two are primary dentin. Okay. Then we have secondary dentin. So the secondary dentin is the dentin, it is the last layer of mineralized dentin. Okay, so below this you will have predentin, so that is unmineralized, right? So over here you have your odontoblastic processes, this is your predentin, and over here you have your secondary dentin, right? This is just a diagram to show you how odontoblasts grow. So over here it was very small, so the first layer of dentin is laid, that is the mantle dentin is laid. Now the odontoblast grew over here, so the circumpulpal dentin has been forming, okay, and it forms the primary dentin. Now it grew further over here, and then you could see the last layer of mineralized dentin that was formed, it was the secondary dentin. And then the last layer of dentin that is formed, that is the predentin. Okay, so it is unmineralized and it is the last layer. Now coming to the primary dentin. So primary dentin is the dentin that is formed before root completion. Okay, It is of two types, mantle and circumpulpal. So when the primary dentin is being formed, we don't have any root completion. Okay. Mantle dentin, it is the first formed dentin in the crown below the dentino-enamel junction. I told you about that. Okay, it is soft. It provides cushioning to the tooth. The organic matrix has large collagen fibers, so it is slightly different in composition than the normal dentin. Okay, then the circumpulpal, or you can see the dentin that forms the bulk of the tooth. The mantle dentin has slightly different composition, so the collagen fibers are larger. Okay, than that is present in the rest of the primary dentin. The thicker collagen fibers, they are agrophilic, so it means that they are silver staining, okay, and they are known as Koff's fibers. They are not really just fibers, but they are known as Koff's fibers, okay. They mainly contain type 3 collagen, okay. It is about 20 micrometers thick, okay. Compared to the circumpulpal dentin, the mantle dentin is less mineralized, so it is soft, it provides cushioning, right? So it is slightly less mineralized and it has fewer defects. And the circumpulpal dentin, so the dentin that forms the bulk, mineralizes either by linear or globular pattern, whereas mantle dentin only mineralizes by globular pattern. Okay, so the this pattern of mineralization, so I told you this will happen at the circumpulpal dentin. It will, the bulk, it can undergo either linear or globular mineralization, but the first layer, it will only have globular mineralization. Okay, now the second layer, that is the circumpulpal dentin. It forms the bulk of the tooth. The collagen fibers are much smaller, so this is 0.05 micrometers. Over here you could see it was 1 to 2 0.1 to 0.2 micrometers. Okay, so these are much smaller in diameter and they are more closely packed together. Okay, this is slightly more mineralized. Now coming to the secondary dentin. So we talked about the first two layers, the mantle, then the circumpulpal. Now coming to the secondary dentin. This is the dentin that will be formed after the root completion. Okay, so now entire bulk of the dentin is formed and this is the last layer that is being formed after the root has completed. So it is a narrow band of dentin surrounding the pulp. Okay, and it represents the dentin formed after root completion. It contains fewer tubules than the primary dentines. So the number of tubules is slightly less. A bend can be seen in the primary and secondary dentin interface. So over here you can see this is your primary dentin and you can see they move in tubules, right? But normally this would be like this, right? But over here you can see the bend is there. There is a slightly greater bend in the between primary and secondary dentin. So this is the secondary dentin and this is the primary dentin. Okay, secondary dentin is formed more slowly than the primary dentin. Okay, it is not formed uniformly, so it is more haphazard kind of. Okay, it appears in greater amounts on the roof and floor of the coronal pulp chamber, where it protects the pulp from exposure in older teeth. Okay, so it will be higher in concentration around the pulp and it is not formed in response to any external stimuli. So this could be a misunderstanding, that you would think that okay, it is secondary, so maybe it is formed due to some injury or it is formed later on in life, but that does not happen. It is formed before eruption. It is just formed it is formed after root completion. Okay, so it is just there to protect the pulp from any external stimuli, because it is surrounding the pulp. It is the last layer that is being formed, so it is surrounding the pulp and it will protect the pulp from any stimuli due to any attrition in older age. Okay, now coming to interglobular dentin. So this is the last topic for this lecture. It is a type of dentin. uh, it is a hypomineralized structure. Okay, so it is formed when mineralization doesn't take place properly. So the mineralization of dentin begins in globular areas that fail to cohere to form a homogeneous mask. Okay, then the zones of hypomineralization form between the globules and that is known as interglobular dentin. So what happens is, I told you about the globular pattern of mineralization. So imagine I have this my organic matrix. This is my entire organic matrix and now I am mineralizing it. So if I go through the globular pattern, I have these globules. Okay, and they are supposed to cohese together. Okay, so they are supposed to like fuse together and form a mineralized mass. So this would what an ideal dentine should look like. But maybe if I have the globules and they didn't fuse properly, right? So they maybe missed out this area. Now this hypomineralized area that is just organic matrix, this is called interglobular dentin. Okay, so this is very clearly visible under the microscope. Okay, this can be seen in crowns of teeth in the circumpulpal dentin. Okay, it follows an incremental pattern. So the dentinal tubules do pass through these. So if you look at this diagram, you can see the tubules passing through the interglobular dentin. Okay, so this is saying that it is a problem of mineralization, not of the matrix formation. So there is matrix in here. You can see a rhythmic pattern of how the matrix has formed. Okay, but you can't see any mineralization, right? In dry ground sections of some of the globular dentines may be lost and a space results, so this becomes emptied. Okay, and it appears black in transmitted light. The interglobular dentine, it occurs most frequently in the cervical and the middle thirds. So in the your tooth it will happen most frequently over here in the cervical end and the middle end. Okay, and in the coronal end in the crown. Okay, uh, now, in the root dentine, it occurs most frequently in the cervical third, followed by the middle third. So, also in the root, it will happen most frequently over here and over here. Okay, so this is it for this lecture. I hope you understood all the topics. In the next lecture, we'll discuss the 8 changes and the various structures associated with the 8 changes of dentine. Okay, thank you.